You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have Florida's go-to implant dentist, Dr. Michael McClure. Dr. McClure, welcome to the program.
Thank you for having me.
All right, great. Now, before we get into today's topic, and I have lots of questions for you, who's the typical implant patient you see?
There's two different categories. Patients that have their teeth that are going towards dentures and patients that have dentures. Now for the ones that are headed towards dentures, those are patients that are seeing their dentist all the time. And that's part of the problem with those patients. They're going in and out, they're having pain, swelling of their gums, infection, bad breath, flaring teeth, things that they're tired of dealing with, and they're headed on the road to having those teeth taken out and getting dentures. And we help them with that.
Okay.
Then there's a category of patients that have, they already have their dentures. And they may not have seen the dentist for the last 6, 7, 8, 9 years. And those are the harder patients to actually reach, but those are the patients that we could actually help the most because they don't know what they're missing by not having teeth that are actually fixed in their mouth.
So, and we talked about this on the telephone, that you say people on the day of the surgery or on the day of the procedure, they can walk in with no teeth and walk out with teeth that don't come in and out, that are fixed in their mouth. Is that right?
That's correct, and we do that all the time. We'll have patients come in. It's not the first time that the patient will actually come in and see us.
But you have consults and things like that first,
correct.
Obviously.
But the day of surgery, when they come in, they will expect to be leaving with their fixed teeth in their mouth.
Okay. Now, I guess how implants are typically done is you go to one place, like maybe an imaging center. Then you go to the surgeon. Then you have another dentist that puts the teeth on top. You have training, I guess, in both the surgery and then the restorative, as you call it, putting the teeth on. Now, aside from convenience, what's the benefit? Because it's all done under one roof. Is that right?
It is all done in one roof. It's all designed and planned under one roof, and that's really what the main benefit is. The surgeon, which would be me doing the procedure, knows where the teeth are going to be, knows where the teeth need to be, actually, which is better
the appearance.
For the appearance and for the ability to eat and chew and smile the way you want to, for your face to be full like it should be. For everything, as far as the functions of the dentures go, you want to have a team that's actually driving and is completely of one mind. And that's what you get when you come to our office.
Now, in Florida, where you are there a lot of people wearing a denture? Like an upper lower denture?
There are. In fact, in Jacksonville, we have TIAA Bank Field, which is the home of the Jacksonville Jaguars. You could fill that stadium 3 or 4 times with the number of people that are missing 6 or more teeth in the immediate area around Jacksonville. And actually, the people that are probably viewing this right now, there'd be that many people. In fact, in the state of Florida, there's hundreds of thousands of people that fall into that category.
Like an upper lower denture.
Upper lower denture. And in the United States, current estimates, depending on the study that you look at, you're looking at 40 million people that have missing all of their teeth on one or both of their arches.
Well, if it's so good, then why doesn't everybody do it? Why don't all these denture wearers come in and get their teeth locked in, supported by dental implants? What's your take?
My take on this, or my opinion on this, is that there's several different reasons why people might not be following up with it. The first group of patients would be patients that have dentures. And like I said previously, it could be 6, 7, 8 years since they came in and last saw the dentist. So they don't know about these options.
So they don't even go to the dentist?
No, they don't go. They should go. There's lots of reasons besides getting your teeth, fixed in your mouth and being able to function. There's other health reasons to go, but they don't come in, and that's why they don't know about it. And then the second group of patients would be, let me put this in perspective.
Okay.
Let me tell you what your life was like before. If you're a denture wearer, what your life was like before you had dentures.
Okay.
You had spent probably the previous 15, 20 years going to the dentist 20, 30, 40 times a year, getting things worked on, fillings put in, patches on those fillings. You might have had a root canal and the root canal failed, or you broke a tooth and had to have it extracted. You may have had bad breath, flaring teeth, infections all the time, sensitivity that everybody hates when you eat something that's hot or cold. All these things that just made it where you do not enjoy your teeth. So when your teeth are actually finally extracted and you have dentures placed, you're relieved. You're
Like
happy.
the pain's over.
The pain's over, and the
right?
back and forth is over, and there's a relief to it. And the funny thing is, as much as they hate their denture when they get it, because the first week, first month, first year, for some patients it's forever, they hate the denture because it's big, it's bulky, it's like having a mouthful of marbles. You ever try and eat with a mouthful of marbles?
No.
It's not an easy thing. And the patients, people do not like they don't like that. But as much as they don't like that, a lot of people adapt.
Okay.
And because we're humans, we adapt to our conditions, and they'll adapt, and they'll get to the point where they think, oh, everything's okay. And I definitely don't want to go back to the dentist and get in that cycle again, because it was not pleasant
So
for
they're
them.
afraid of the dentist. The last thing they want to do is see you.
Yeah, and that would be another category of people that are afraid of the dentist, that are just fearful. They had bad experience when they were children. A good example is I had a patient who was literally, I would call this guy a giant. He was huge. He was about 6'10". And when I walked in the room, every time I walked in the room, he'd get up out of the chair. And I'm like, whoa, why is he getting out of the chair? And he started apologizing instantly. I'm so sorry, doctor. I don't know what it is. I just can't sit in the chair when you come in the room. And we talked for a while and figured out it was probably when he was younger and a child.
Like a phobia kind of a thing.
Tremendous phobia that prevented him from coming to the dentist. Somebody who had need for root canals on multiple teeth, so he was having tremendous pain. And even with that tremendous pain, it was keeping him out of, his fear was keeping him out of coming into the office. So his end result for him was we were able to get him in. We used sedation on him because we do sedation, we do IV sedation. And we were able to get him in and work on improving his smile, fixing the problems that he had, getting him out of pain, getting rid of the infections. And we were able to do it because we sedated him. We do IV sedation in our office. And the ironic thing with him was that he came in completely fearful, couldn't be seen. By the end, at the end of when we were delivering all the final prosthesis, everything that we did is delivering his teeth, he didn't need sedation anymore.
Okay.
He was able to reason, as an adult, that it wasn't as bad as he was thinking. So now he comes in, gets his teeth cleaned. We don't do sedation on him anymore. No problems at all. So that would be the third group of patients, the fearful ones that don't come in and that get the fixed teeth. And back to your original question, why patients don't come in and get the dental work done or implants placed for fixed teeth. There's a group of people out there they basically self-diagnose themselves out of being able to get dental implants. Some of them will come in and say, well, I'm too old. We have patients come in all the time. Last week I had a patient come in that was 70 years old, and that's what they said, I'm too old for dental implants, and they aren't.
Well, how old can you be?
Well, we've had oldest patient I've had is an 88-year-old.
Really?
An 88-year-old. The reason he came in was his wife actually kind of forced him to come in. She was a little bit younger than he was, and they were a very social couple that went out with all their friends. They'd go out and usually end up eating somewhere and socializing. And about 5 years before he saw me, he had to have all of his teeth taken out and had dentures placed. And when the dentures were placed for him, when he had dentures, he couldn't function with those. He couldn't eat anymore. He couldn't do anything that he wanted. So he started avoiding his friends.
So his wife, what? His wife hears about you, drags him in.
His wife is a patient of ours. She ended up bringing him in and bringing him in and talking to me and saying, is there anything you can do to help him out, to help him out? So we brought him in one afternoon. We were able to give him a fixed set of teeth that don't come in and out of his mouth, that he can function with. And the ironic thing was when he first started seeing us, he would come in not dressed. He'd come in pajamas sometimes.
Okay.
Because he just wasn't going out. He was living basically as a hermit. And when he came in to get his teeth that day that we were delivering his final teeth, his teeth that are put in and they don't come in and out, he came in a suit. And we're like, right? What are you doing? You're all dressed up. You going somewhere? And he said, after I leave here, I'm going to go eat a steak at his favorite steak restaurant.
So what can they eat? Like when they're all healed up, do they have restrictions, or they could eat like raw broccoli or a carrot?
They can eat like they ate before when they had their teeth.
Okay.
They can enjoy the things that they love. If they like to eat ribs, they can eat ribs or chicken wings, which is...
Do they tell you eating stories?
I have patients tell me eating stories all the time. I've even had a patient say, I can eat peanut brittle now. Now, I don't recommend that you go out and eat things that you couldn't eat before, but peanut brittle, great. If they want to eat a salad, buy
or
a patient,
nuts, they can eat some nuts, things like that?
It's possibly nuts.
So it's just like your regular teeth.
It's just like your regular teeth.
So this is like the hottest, newest thing in dentistry.
It is.
Replacing teeth with dental implants. Do you think this is the future of dentistry? Maybe 20 or 50 years that dentures as we know them today that aren't attached to anything, do you think the future will be everything will be attached, supported by implants?
I hope it is, because people that wear dentures cannot, the day that somebody who has dentures for the first time, when they have their teeth extracted and they have dentures put in, they can't eat, literally can't chew up to 20% of what they were able to chew before. So if you imagine what you used to be able to eat, what you would love eating when you were younger and you had all your teeth, now take 80% of those things off of that.
So like a sourdough bread, you can't pull it out of your mouth, or chewy things.
With a denture, yeah, you can't bite through things. With a denture, you need to be able to basically learn how to chew differently. You have to
no
learn
more
how to
dentures.
Chew. No more
Just
dentures.
like we said at the top of the program, nobody should be wearing
a
loose-fitting denture. So you say this is life-changing for most of these patients.
It is. It is life-changing. We had a young man who came in and saw us, and he was right about 40 years old, and he had basically no teeth that you could see. They were all broken down and decayed. He didn't have good dental care when he was younger, and it just continued on into adulthood. And he came to us, and we treated him. We took out his bad teeth, put dental implants in, and we gave him a fixed set of teeth. Now, his main issue was he wanted to be able to eat. He's like, I just can't eat. I don't feel like I'm healthy because I can't eat the things that I want to eat. That's what brought him to us. And the day that he came in and we gave him his fixed teeth, I sat him up in the chair and I handed him a mirror and I said, John, what do you think? How does it look? And he held the mirror up in his face and he smiled, looked at his teeth, and he sat the mirror down and he turned his head. And in my mind, I was like, oh my God, he doesn't like it? I think they look beautiful. I'm like, John, you all right? What's going on? And he turned and looked at me and he couldn't even form words with his mouth. It was quivering and
so happy.
He was so happy.
You're even getting a little choked up even telling me this story, by the way. It's very nice.
It was life-changing. And after a minute or two, when he gathered himself up, he said, this is the first time I've seen myself smile with teeth in 15 years.
Jeez. So that's common. You get a lot of that.
We do get a lot of that.
I mean, like when they're seeing their smile for the first time, your assistants or whoever's involved, you guys ever probably get a little choked up too?
Yes. You can't help but get choked up to see the emotion on these people because a lot of them don't realize what they don't have until they get it back. And then when they see themselves, now they're like, I didn't even realize what I was missing. Like for him, he wanted to eat. But in reality, he wanted to see what he looked like with teeth.
Okay. So what do they like the most? Do they like what they could eat or do they like the way it looks?
It's funny. We have a group of patients that come in that say they're here because they want to be able to eat what they want to eat. And then you have another group of people that come in and say, I just want a pretty smile. I want my teeth to look like they used to look, and I want a pretty smile. But what we find is once going through the process, all the people that wanted to be able to eat, all of a sudden, they really like the way they look. And the people...
because they get compliments, things like that.
Correct. And their self-confidence soars. Now, going back to the other story, the 88-year-old, an example of him, or even going back to the last patient, John, when he first came to us, he was very withdrawn. He didn't smile. He always looked mad, but I knew he wasn't mad. He just didn't smile. And it was after he got, and his main complaint was he wanted functioning. But when he got his teeth and all of a sudden he's got a smile back, his confidence soared. And he was
good.
He became the person walking into the office before you didn't even know he was there. It's like there's somebody in the in the waiting room. He's quiet as can be.
Okay.
Now he walks in the door and smiles high. He's loud. He flirts with all the girls that come in the office. His life is completely changed.
Is it true you say some people just want to hug you when it's all done?
That happens, yes, it does.
That doesn't happen in a root canal or anything else, right?
No, it's never happened on a root canal, I can say that. But yeah, because you really do change their life and you feel it. I mean, if you have to feel it. If you have a heart, you feel what they're going through. And you can empathize with the pain that they've had, because I know how hard it could be to not have the teeth and be able to eat like they want to, or be able to smile and do the things that they want to do.
When you're on a consult, okay, so a patient hears about you, that you're giving people denture wearers a brand new set of teeth, or people that need a full mouth of extractions, a brand new set of teeth. When they're telling you their hard luck story, do you ever kind of get excited thinking they don't know how good this is going to be?
Of course. You can't help but get excited, because you know what the future holds. You have a good idea of you have a great idea of where you're going to go. I can see their end result before they can, and you can't help but get excited. I had a patient that I talked about previously who his wife was the inspiration for bringing him in. She wanted him to get a life, to basically come back to their marriage, because he had become a recluse and wasn't going out and doing the things that they wanted to do, or she wanted to do things that they had done previously. So we gave him fixed teeth. He had those teeth and lived a life for the next 7 years. His wife came in after those 7 years. The story is that she actually came in and because he had passed away.
Yeah.
And you mentioned, has patients ever hugged you?
She did.
She did.
That's nice.
Because she got her husband back.
So, because look, I know a couple of denture wearers. Never complain. They never complain.
Well, they'll never complain to you, Randy, because you're not a dentist.
Okay, that's a good point.
They'll come in and complain to me. We hear about it, and I see the suffering that they go through. And the changes that happen from the day you get your teeth extracted until the day you die, your jaw is going to get smaller and smaller and smaller. So your dentures that would fit when they first were delivered, when you first got dentures, they don't function well. And the best denture in the world, like I said, you get maybe 20% of chewing efficiency with it. You're being able to eat about 20% of the things that you could.
Like you're just kind of rubbing your food together.
You're basically exactly right. And the other side of that is, not only are they not being able to eat the food that they want to eat, but the food they do eat, they don't get the nutrition out of that food. If you look at any study that's been done, and there's been many, many studies that have shown this, that patients that have dentures, they live a much lower quality of life and quantity of life, years. They don't live their life, and they don't live as long. They live as a much sicker, much more likely to have diseases.
Because the food is like they're almost kind of swallowing it a little bit
whole.
They're
swallowing it whole. They're not getting the nutrition
so you get like
out
indigestion or problems.
Indigestion, your doctor might say, well, you need to get some more fiber. And if you're wearing dentures, you're thinking to yourself, well, good luck with that, because I can't chew up anything that's fibrous. So, you give those patients, they might start taking Metamucil. And what does Metamucil do to your stomach? For a lot of patients, it really upsets their stomach, and they end up not being able to take that. So that doesn't help either.
Now, you're a dentist. You probably think that the smile is like the most important thing. Mm-hmm. How important is a smile?
It's one of the most important things. In fact, if you look at any study that's looked at what do people find most important in a spouse or
like what do they find attractive?
Yeah, what do they find most attractive? A smile, if it's not number one, it's always in the top three.
Okay, that's fair.
So it's extremely important, because it's who you are. It's presenting yourself to the world. If you had a set of identical twins that would go into for a job interview per se,
all right.
And they go in, and one is happy with her smile. Her teeth might be a little crooked, but she's happy with that. She feels self-confidence, and the other one doesn't like her smile. And they're both in there talking. The one who loves her smile, she's going to be smiling when she's talking to the person, and the other one that doesn't like their smile, that doesn't have that self-confidence, is not going to be smiling. Who do you think is going to get the job?
That's a good point.
It's the one who's smiling, the one who exudes self-confidence.
That looks happy and all that.
That looks happy, and they'll. If you ever notice, you walk into a room and you see a bunch of people there, if you see one person who's laughing and talking out loud and smiling, that person's exuding self-confidence.
Yeah.
And
okay.
That's the person people are drawn to. They're drawn to people that make them feel good. If you're a smiling person, you make people feel good.
What about those people that have gum disease? Bleeding gums, bad breath, loose teeth, and their teeth are like very, very loose. Can they get dental implants with bad gums, is my question.
Absolutely, and those are people that we can help the most. If they have teeth that are beyond the point of repair, and we can gently take their teeth out, allow their gums to heal back up, and then place dental implants in there, we're basically resetting them. The gums get healthy again, and then what we do is we remove their teeth, we give them a brand new set of dental implants and teeth, and they're back. They're reset back at the beginning. It's basically a third set of teeth that they have.
So how do they maintain them? I mean, just like regular teeth? Like they go to the dentist a couple times a year?
Exactly right. We bring them in, we'll see them every 3 months, and a lot of these patients are happy to come see us now because we're cleaning their teeth, getting them back, they've got their mojo back. They'll come in and we'll do a cleaning on their teeth, keep them healthy. They love to come see us.
So we're short on time, but when a patient goes to you and they're either wearing a denture or you need to extract their teeth, can't save them, and give them a new set of teeth with implants, what's that process like in your office? Like, what are their options?
They have different options as far as implant retained dentures or implant supported dentures. We'll have patients where we can put in a couple implants down on the lower, and then they'll have a denture that comes in and out, snaps in and out.
No more adhesive with that?
No more adhesive with that at all. The dentures, or the implants are there to help retain the denture. They function much better with it. They eat much better with it. If besides the 2 implants, if you added a couple more implants, 4 implants, you could have a bar on that and snap in and out again. And
so more stability.
More stability. The more implants you have, the more stability. The more implants you have, the more your teeth are going to act like your teeth used to.
So they're like you call them what, snap-in dentures?
Yeah, those would be like a snap-in denture. Snaps in and take it out. It's easier for patients to clean the implant, so that's one reason that we do that type of denture.
It's affordable.
It's affordable. It's less expensive for patients to get that. And it's for some patients that have had dentures for a very, very long time, that's their best option because it also fills their face out. It'll give them the look of having teeth like they used to instead of, have you ever seen somebody who's had dentures for a long time and their face is collapsed in a little bit and their chin and their nose are much closer together? It solves that problem. So the next level up from that would be placing a few more implants and having teeth that are fixed to them. And
so a full arch of teeth.
A full arch of teeth that will... The greatest thing about that is that it uncovers the roof of their mouth on the top,
upper.
On the upper. And if you know anybody with a denture and ask them how it works, they're going to tell you the one thing that they hate, one of the many things that they hate about it, is the fact that they can't taste their food. You can't.
Like if you're wearing a regular denture.
If you're wearing a regular denture, you cannot taste your food. Well, when we give you a fixed set of teeth on those implants, it uncovers the palate. Now food is back to where it used to be. You can taste everything that you eat. You can enjoy.
Like hot and cold or
hot
spices.
And cold,
or
spices. It'll be just like you were eating with your teeth previously. In fact, we had a patient who was wearing a denture and his wife was a professional chef.
Okay.
And she would make, all these great foods for him. He wasn't able to eat them anymore when he got his dentures. And that was one of the things that he really missed when he had dentures. So when we got rid of his dentures and got him a fixed set of teeth, he was able to enjoy what his wife was making for him because he could taste everything again. He brought food alive. It reawakened, his love of food that she had, given him over the years with all the things that she could do.
So it is life-changing.
It's life-changing.
For most of these people.
It is absolutely life-changing in many ways.
Now we should mention about insurance because even the best dental insurance doesn't cover dental implant dentistry, only a very small portion. Medicare doesn't cover this. Medicaid really doesn't cover this. So what's the answer?
We have financing, and
People
financing.
are financing this?
No, we have. We work with different companies. You have to have pretty good credit to get financing, but we'll do everything we can working with those companies to eliminate that as a barrier for you to be able to come in and get the
people are
treatment.
financing these procedures.
Absolutely.
So now there's no excuse to not do this. Right?
There is no excuse not to do this.
And IV sedation. We should talk because I know you do a lot of IV sedation. But you say people come in, you numb them up, do a little IV sedation. You say you monitor their like blood pressure, their oxygen levels, but they have like very little memory of even getting it done.
Correct.
Is that right?
It is absolutely right. We have patients that come in now. Usually, we'll bring them in and sedate them first, and then numb them up because that's a lot of patients' fears. They're scared of the needle.
Okay.
And numb them up. And I have patients all the time that we'll talk to them during the procedure. They'll be sedated. But they can talk. We can talk to them, tell them, have them move or whatnot. And they'll come in. The next time they come in, 99% of the time you'll hear the patient say, I don't remember a thing. I don't even remember getting to your office, let alone anything that happened when I was there. I just got home, I woke up a couple hours later and I had teeth and I didn't have any pain. Or if I did, I'd take Motrin or Tylenol, something like that. Okay. Very minor, pain goes away.
Now, I think you told me this, that in certain cases for the people that are afraid, even the night before, you might prescribe a pill so they can sleep.
That's really correct. Yeah, what we do is we want them to have a good night's sleep. So we prescribe medication for the night before, and then they'll come in the office. And if we're doing oral sedation in the morning, we'll give them some medication in the morning. Or if we're going to do IV sedation, then we'll do that. But yes, absolutely correct. We want them to be as comfortable as possible. And if you've been up all night worrying about what's going on, you're not going to have a good experience when you come into our office.
Okay, good. Now, your center, they could have no teeth. And then on the day of the procedure, they'll walk out with teeth that don't come in and out.
Correct.
Not in some sort of a temporary that comes in and out.
Correct.
Okay.
Yep. They'll have fixed teeth that they'll be able to function with, and basically what it is, it's a trial for them to see what they like. Do they like the teeth? Now all our teeth, everything we do is custom designed. We design things for the patient. If we have a young lady that we're doing, then we're going to make the teeth very feminine to how they want them to look. If they have old pictures of how their teeth used to look, we can take those pictures and we have the ability to digitally put them into our workflow and make those teeth. And so that we can give them, we've had patients, for instance, that had she had flared teeth and she was going through the procedure. She was going to lose her teeth. We had to extract all her teeth. And she wanted to get nice teeth when we were done, but she didn't want to get it done in one day where she came in and all of a sudden she goes to work and her friends all see her with nice teeth.
Is that right? Okay.
So what we ended up doing for her is we made her temporaries with brackets on them for braces, orthodontics. And over a 6 month period, it was probably about 3 to 6 month period, we saw her several times, made changes to those and got to the end, and then gave her permanent teeth that
just so nobody would know.
So nobody would know. So it looked like she'd been doing braces for the last 6 months, and nobody at work was any the wiser. She just showed up one day. I got my braces off last week, and her teeth were in and fixed, and she was living life as she wants.
We're out of time, but final message to the patient of the two groups. One group wearing a denture, or another person that they need a full mouth of extractions and new teeth supported by implants. But for whatever reason, they've heard what you had to say, but they're still skeptical. What do you say to them?
Come in and see us. Come in. We have a free consultation. We'll talk about what is available, what your options are. We'll even discuss financing if you want to do that.
Okay.
We will get rid of any barrier that's stopping you from coming in to see us.
So I want to thank you for coming on the show. Great stuff. And they can go to your website, make an appointment. Do they get to see you in your center?
I'm the one that they're going to see. I'm the doctor doing the surgeries and the doctor putting the teeth in.
Okay, good. Thanks again for coming on the program.
Thanks for having me.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.